Hi guys, I hope you're all well. In this video, we are going to explore how to manage time for your Plab 2 exam. I'm going to discuss 7 top tips or tricks or ways following which you can improve your time management, because this is one of the key issues that people struggle for their Plab 2 exam. In the end, I have a bonus for you. I have particularly designed a practicing tool that can help you to practice managing your time. So listen to this video very carefully. Number 1 is changing your mindset. It is one of the major mistakes that people do. They think that time management is all about how you can discuss or talk about everything that you know in that limited amount of time. I mean, it's human psychology that we want to show off whatever we have worked hard for in an exam scenario, but it does not work like that for an OSCE exam like Plab. So the idea is that you have to talk about the important and the relevant things in that limited amount of time, not everything that you know in that limited time. So if you start practicing with this mindset, this will improve your overall station and this will improve your time management. Number 2, make use of the time that you have outside the cubicle. So you have around 90 seconds or 1.5 minutes outside the cubicle. So many people, they just go blank. They are panicking and they are, they might be praying and they do not think and plan about what they are going to perform within that station. Guys, you cannot afford to waste any time even outside the cubicle. Every single minute counts. So there are 3 things you can think about when you are outside the cubicle. Think what are the red flags that you are going to rule out in that station. Think about the ICE and psychosocial aspect, and think about the layout of the management that you are going to do. Go inside with a mind map. What that will do is that it will significantly cut down the ums, ahs and the pauses that you're going to make inside, and so that in turn will improve your time management. Number 3, keep the sentences short and precise. So if you want to ask anything or you want to convey anything, there could be many ways you can ask that. Of course, English is not our first language. What we tend to do is that we normally think that particular thing in our own language and then we kind of translate it into English and then ask it. Try to avoid it and just think in English and try to ask in short form and precise way that will serve the purpose and will not waste a lot of time. I will give you an example. So one of the commonest things we ask in our stations is how you ask a patient to score their pain. So if a patient is coming with a chest pain or pain anywhere, Mr. X, can you please score your pain for me on a scale of 1 to 10, and 10 being the worst pain ever in your life and 1 being the lowest pain? I mean, guys, your simulator will sleep. You can just make it short. For example, you can say, Mr. X, how bad is the pain on a scale of 1 to 10, 10 being the worst pain ever? So if you are saying that 10 is the worst pain ever, they can, comprehend that if 10 is the worst pain, 1 would be the lowest pain or no pain. So this was an example, but I hope that makes sense. You have to keep things short. Similarly, when you go inside, keep your intro short, up to 20 seconds at max. Just introduce yourself briefly. Do not drag things unnecessarily, if that makes sense. Number 4, keep your history short and focused. This is the major thing that people struggle, and this is an art actually that you need to practice and master. You need to basically rule out the red flags, most importantly, and maximally just 3 differentials. Do not go on asking irrelevant questions and trying to rule out 10 differentials. That is just going to waste your time. When you're taking history and gathering data, think that whatever you're asking, if that is going to help you in your second part of the station, i.e. if that is going to help you with the management. For example, if a patient is coming with a tennis elbow, if you've got any orthopedic problem or anything in the past medical history, you got to know that he's got past MIs and kidney problems. If you are going to go into detail of that, like asking if he's exercising, if he's smoking, if he's drinking alcohol, okay, we have a set of standard questions in our or approach that every academy teaches you. But do you think in that particular station, is that going to help you managing that orthopedic problem? Your history should be revolving mainly around the presenting complaint and the main concern that the patient is having. I do know that we have a standard set of questions that we get from academies like the P2 Maftosa, the DESA and all that. Those are important, but scenario wise you have to filter that out and see what's more important. Similarly, for example, if there is a palliative patient who is in the end of life care, do you think it would be worth asking if the patient is smoking, drinking alcohol? In that scenario, the important bit would be to know the psychosocial and the support around end of life things. So you need to be very specific and relevant in your questions. This is something if you keep in mind when you are practicing or preparing for your Plab 2, this will make your time management way more efficient. Number 5, give an overview of your management before you go deep into it. What I mean is that when you are starting to manage the patient, even trying your best, you might not still be able to finish the things in time. So if you give a layout in the beginning, the examiner will know that at least you had those important things in your mind. For example, what we do in the management, we normally do the symptomatic treatment as a junior doctor, like if they need any painkillers or antiemetics or anything that can improve the symptoms, we offer that. Then we involve the senior if there's any referrals needed, any admissions needed. We safety net. That's one of the most important things, and other bits and pieces depending upon the station. And just be sure that you manage the concerns, you do not manage the stations. Do not go with the script. Just get it very clear in your data gathering that what are the main concerns of the patient, and then you manage that. So when you are doing the management, you can say that Mr. X, I'm going to give you this, and then we'll discuss some management options. In the end, I'll give you a leaflet and some safety netting information that would be crucial to be aware of, so you know when to seek medical help. So when you say this and then go deep into your management, so by any chance if you fail to finish the station in time, the examiner will know that at least you are a safe doctor. Number 6, you have to be fluent in your speaking. So now this is something I want to emphasize again, and do not get me wrong. This does not mean that you have to speak fast and try to rush on your station. That will just mark you down with your interpersonal skills. So what I mean is that you need to be fluent. You have to minimize your it's natural to have a little bit of pauses. That's natural for everyone who speaks, even if they are a native speaker. Although English is not our first language, you have to practice being fluent. So what you can do is that try speaking in English with your colleagues, even when you're not practicing and just discussing day-to-day life. Try to speak as much in English as possible, and you can watch English movies or serials. There's a show called GPs Behind the Door. It's actually filmed how real consultations take place. That's one of the things I would recommend. Even though you can get away with it, but I've seen that people who are fluent with their English, they struggle less with the time management. This is something you can work on, and it will be helpful not just for Plab, but also when you'll start working here. Number 7, so now this is the bonus tip and the bonus tool that I've particularly created. Practice is extremely crucial, guys, for this Plab exam. Practice. You'll hear this from everywhere. Initially, when you're starting, practice on an 8-minute timer, and then later on try practicing on a 7-minute timer. Why I say that is that in the real exam there would be the element of anxiety, and that can eat up a little bit of your time. So if you're practicing on 7 minutes, you will be more safe to finish your station in time. I've created this color-coded timer. So what you can do is that when you're practicing, you can keep the timer on in your peripheral vision, like on the side of you, so you can see the screen. The screen will turn blue. That means ideally you should be taking history in that time period. And then the screen will turn green, and that would indicate that ideally you should be managing your patient now. This is something that would be on your side vision, so you don't actually have to look at the screen, but you would be still able to know that where you are standing. The ideal time to start management is at around 4 minutes. In the real exam, you get a bell at 6 minutes, and many people think that this is the time you start managing, and I think that would be the worst thing you would do to yourself. That would be the worst advice I would say if you're starting your management at 6 minutes. There's a lot to talk about in management, and your interpersonal skills are mainly tested in your management. You have worth 8 marks there, so spare time for that. The intro should not be more than 20 seconds. So after intro, the color of the screen will change, and after ideal history period, the color will change. So I hope that helps. Try to practice with these timers. I've tried to keep the ads off on these videos though, but if by any chance you are getting any ads on the timer or any video, let me know, because that's not going to help you if the ads are coming in. So I'll try to find a way how to switch that off. So yeah, I hope that helps. If you have found this video useful, do like and comment so I know that it's helping you, and do not forget to subscribe, and I'll keep on making more videos. You can also join my WhatsApp group or the Telegram group for the Plab 2, and you can DM me if you want to do any mock sessions and one-to-one sessions, which I'm planning to do in near future. But because I'm a full-time trainee, I'm not getting too much time for that, but I'll try to see what I can do. And yeah, I'll see you in the next video.